perform a modified low dye, you need a foot, you need some Leuco tape, some cover roll, and some scissors to cut the tape. You'll start with the cover roll. This is a protective layer for the foot skin, so you don't rip it off with the Leuco tape. You're gonna start out with a tape that goes around the foot, from the medial side to the back, all the way to the lateral side. You measure that out. Cut it. Take the tape backing off. Typically like to start right around the base of the big toe, making sure that there's no folds in the tape. Like so. Then the next two pieces of tape are a locking mechanism. One will go on top, and then another piece will go on bottom. If you find a fold, what you want to do is kind of peel the tape back, fix the fold, and then reapply. Like so. Now that I have this base layer on, I'm going to apply the more aggressive tape, which is the Leuco tape. This is the key to a good modified low dye. It's having this tape. And what I'm going to do is I'm going to mimic exactly what I did with the cover roll tape. I'm going to start here, tape around and create a pseudo arch, and finish on the outside of the foot. If I want it to be tighter, I'm going to push this first toe down, or this first ray, so that it creates a more aggressive pseudo arch. I'm going to start right here. For him, I'm just going to apply a little bit of downward pressure, come across. The next two pieces of tape are a locking mechanism. Sometimes when the patient's walking, you can feel like their toes are being pulled up because this tape up here is too tight. If that's the case, all you have to do is pull this up, point the toes down, and then reapply the tape. What's great about this tape and the modified low dye is it can stay on for about 7 days. If it gets wet, pat it dry, and if it gets itchy, take it off. That usually means that you're having a reaction to the adhesive, and it's not going to be beneficial because you're going to break out in a rash or hives, and that's not worth the tape. This is a modified low dye.